All right, so many Americans suffer every night not being able to fall asleep. News 19 on your side today, getting your sleep questions answered. We invited our friend Dr. Robert Puchalski back to talk with us. You have a lot of titles. You are an otolaryngologist. You are a sleep study expert. And anything else? Can you fly?
No flying. Can't fly.
All right. There's so many. Everybody has an opinion on how you should fall asleep. Everybody's got an opinion on what's the best remedy.
There are a lot of remedies out there and a lot of opinions on remedies out there as well.
Okay, so we wanted to go over first all of the things that we have heard somebody tell us throughout the years. Does taking, if you can't fall asleep, does taking a hot bath work?
Taking a hot bath works. So it helps, but not for the reasons you might think it does. It's not the heat of the bath that actually helps, but it's the cooling effect after the bath that helps prepare your body and signal that sleep is coming.
Really? Because I would totally think that it was the heat.
No.
Interesting. All right, number 2, lavender. There's so many candles out there, or body washes, or bubble bath that says that it's a calming effect. Does that actually work?
So that's inconclusive. We don't have good evidence to suggest that lavender actually induces sleep. We have some evidence that suggests that it might lower your heart rate or lower your blood pressure, but it's very difficult to do studies on smells, on aromatherapy, as opposed to something that you ingest. And so consequently, we don't have any good studies that really show that that helps. But there's a crowd of folks who will testify.
Who swear that lavender helps. Yes, I've met some of those. All right, Grandma always suggested the chamomile tea. What is actually in chamomile tea that helps you sleep, or they think so?
Chamomile works. Chamomile is related to ragweed, so you have to watch out for it if you're allergic to ragweed. But it works, and it's been used for thousands of years by many cultures to try to induce sleep. And there's actually been studies in animal models that show that chamomile is as effective as some prescription drugs at inducing sleep. So yes.
Oh my goodness. Okay. Do you? I mean, and it's best to have it in the tea form, even
in the tea form.
Okay.
2 or 3 bags into a teapot. Is helpful, yes.
All right, I'll do that one. Okay, my mom swears by this, melatonin. It's a natural supplement that you can get at CVS. What do you think of melatonin?
Melatonin's great. Melatonin's natural. It's a naturally occurring hormone in the body. It's converted from serotonin by the pineal gland when it's dark, and it's something that works. It's good. It works for jet lag, but it also works for inducing sleep as well.
I know you've done a lot of studies on looking at your cell phone at night. This one's sort of connected to that. How about reading before bed? Yes or no?
So reading is helpful insofar as it occupies the mind, it distracts the mind, it helps to relax. We just ask and tell my patients to try to avoid doing it with a backlit screen. Try to do it in the traditional manner, and try to do it outside of bed, because we want to try to preserve bed for sleeping. And so do it in a nearby chair, and then when you're ready for bed, go ahead and do that.
All right, next one's kind of funny, but I had to put it in there because everybody says it and I don't even know why. What is the deal with counting sheep?
Oh, counting sheep does not work.
That does not work.
It does not work. I don't get it. It does not work. It's too repetitive. It doesn't occupy your brain enough. It isn't distracted enough. And actually, one Oxford study shows that it actually slows the time to induce sleep.
Oh my gosh. All right, cross that one off the list. Okay, only 2 left. Warm milk.
Warm milk, and this one I'm sad about too, because my mom used to give it to me, but it does not work. So there's an urban legend out there that tryptophan will induce some sleep, which is a naturally occurring amino acid or protein in many foods, and unfortunately there's no study that's ever been able to prove that warm milk helps.
Bummer.
But there's some psychological effect, maybe. Yeah.
And finally, your feelings on sleep drugs. Lots of people, millions of people on sleep drugs.
Absolutely. In fact, last year we think that up to 10% of the population at one point or the other during the year was on some sort of prescription sleep aid, and so it's very widely used. Oftentimes there's some health risks that go along with using those medications. They certainly are effective, but you've got to be worried about addiction. You've got to be worried about something called tachyphylaxis, which means that the drug doesn't work as well over time.
Right, of course.
And so in short periods of time it is effective and should be used.
Okay, so before we go, you were talking about the importance of having a cool environment to sleep in. Explain to our viewers why that works.
So cool environments are good because your body naturally dips its temperature at night, and so you lose some portion of your body temperature within 3 to 4 hours of sleep. And it starts about 2 hours before going to bed on your natural rhythm. And so trying to adjust your room temperature and the ambient temperature to something colder, something closer to 68 degrees, for instance, is more natural and has been shown to improve sleep quality.
I like that. So you might want to crack a window.
Absolutely.
Crack a little window. I love that. Dr. Robert Puchalski, our friend from South Carolina ENT, thank you so much for coming back. I hope that has helped you get a better night's sleep tonight. Stay with us. You're watching Friends at 5 on News 19.